or to go into environments where, should you be positive, you will be really knowingly infecting folks. Not all tests are the same, and as we hear more about testing and as different kinds of test venues become more widely talked about, especially with our college students going back into community living situations on college campuses, it is easy to get confused about the three kinds of tests. There is the gold standard, which is called the PCR test. Those are the ones that have very good sensitivity and specificity, which means if they're positive or if it's negative, you can have a very high level of certainty that that's the correct result. The trouble with those tests is that the turnaround time can be variable. It doesn't take tremendously long to run the test, maybe an hour and 15 minutes. But if your testing facility where the tests are being processed is overloaded, the results might take days to return. So the other kind of test that's out there now is what many of you are hearing about. Oh, I went and got a quick test. Those probably are the antigen type test, and those can be done quickly. If they're positive, that's you can believe the positive is how I'm interpreting the different laboratory requirements. However, the chances of a false negative are there, and so in our laboratory, our false negatives, and we never do this test without a backup test if we're suspicious, that run at about 17%. So that's substantial enough to utilize this quick test in arenas where you understand how to use the results. You would not want to use the quick test as a standalone test in a sick person. On the other hand, you might use it in a large college population and perform the test because you have a large asymptomatic population. You're also hearing something about pooled testing, and that's being used with that PCR test, where you can take large samples. For example, if it was your challenge to do 10,000 tests and you needed to process them in a day or two, you can put all the samples together, and as long as the test comes out negative for that sample, you may be able to report out 50 or 100 at a time off of that one test. However, if you get a positive in that batch, you'll have to stop and go back and repeat the test for each individual. Nonetheless, that will reduce testing time, and it's being done around the country, and I believe in Alabama. And then the last is the antibody test, which really doesn't have a place right now as we're working through this stage of the pandemic, but that's a test that presumably will tell us if you've been exposed and mounted an immune response to it. As our schools go back, testing, lots of testing is being asked for by colleges where people go and live. Not quite such an issue when you're going to school to stay for a while and then go back home again. But all of our schools have protocols, lots of protocols, and they are as good as the enforcement and compliance with them, just like our masking ordinance. So so long as we can limit community spread, which is what we are trying to do now, and keep our curve flattened, we can do good contact tracing and isolate folks to keep control of this pandemic in our community. That's it, Don.
Thank you, Dr. Hudson. We'll turn over to Mayor Battle.
Thank you, Ms. Webster, and to everybody out there, we first off want to start off with our appreciation of our healthcare industry, our HMA, our EMA folks who are out there working emergencies and emergency situations, and our public safety officials who are out there helping on a day-to-day basis to make sure that we get through this, and they have to go into some of the cases where it's very hard to wear a mask and gloves and everything else, and they do. And to each of them, we say thank you for the job that you're doing. When we look across, if you want to look at trend lines, Madison County trend line, we peaked probably about July 21st, 20 days ago. We peaked with 2,038 cases for the last 14 days. If you look at today, we have 1,002 cases for the past 14 days. And those are the people, if you take the quarantine period of 14 days and you figure out how many you've had added each day, when you start putting those numbers together, that's the number of people who would be actively positive out in our community. So we've had a significant drop from that 2,038 to the 1,002 cases. If you want to look and compare our metropolitan areas, when you look at our metropolitan areas, the cases per 100,000 for the past 14 days, Madison County's had 283. Jefferson County has had 420 compared to our 283. Montgomery has had 450,000 compared to our 283. And Mobile has 743 compared to our 283. So we're looking at a situation where we are looking much better than our other metropolitan areas all across the state of Alabama. If you look at deaths, it's unfortunate we had 4 additional deaths this weekend. Any death is one too many, but we have had 34 deaths, which are tied to the COVID-19. Jefferson County has had 244. That's compared to our 34. Montgomery's had 149. Compared to our 34, and Mobile has had 207 compared to our 34. A lot of people wonder, say, why is our system working so much better? Why do we have less cases? Why do we have less cases per 1,000? Why do we have less deaths? And I have to say that we have a great hospital system here, a great medical system here that has been able to take this on and take this on very well. To Dr. Hudson and to her cohorts at Crestwood, to everybody at Huntsville Hospital, thank you for doing the job that you're doing, because of the work that you're doing, our community has been hit a little bit less than others. Second thing is that our community has taken this very seriously. You see people wearing masks on a regular basis. We're staying separated. We're staying sanitized. We're trying to make sure that we do the best we can with through this situation, and we have a smart population who is following through with what we need to do. We as a community have to continue to do this. It's not a choice. It's something that we have to continue to do. If we continue to do it, we will see the same success in the future as we have seen in the past. And I want to thank everybody who's been part of that success that we have made, and that's everybody sitting out there, because they've been part of the success. But we've got to continue doing exactly what we've been doing. I think next week we'll probably see the results of alcohol sales being stopped at 11 o'clock at night. I think that may play into even more numbers of taking us down and taking our numbers down. So as we go through each of those steps that we've done, from masking to separate to sanitize to stopping alcohol sales at 11, each one of those steps adds a little bit to the success that our community's had. Thank you, Mr. Webster.
Thank you, Mayor. Okay, thank you for watching today. We will be back on Wednesday, August the 4th, August the 12th at noon with another daily briefing. Until then, critical updates will be posted on the City of Huntsville COVID-19 webpage and on the website of our partners here today. Please stay safe, stay separate, and remember to sanitize. We will take questions at this time. When you come to the microphone, if you would, please identify yourself and who you're affiliated with, and we will allow one question and a follow-up.
Sorry for the pause. Brian Lawson, WHNT. For Dr. Hudson, a lot of schools are going back this week. A lot of students are going back to school. I wonder, as a parent, as a doctor, what you tell parents about what kind of monitoring they should be doing of their student. Questions like, how was your day, don't seem detailed enough. I wonder if you got some advice on parents checking kids' behavior, and any advice to kids about how they should behave.
Well, Brian, thank you for that question. I think I live that advice every day, but I have a teenager, and so the answers are, not quite as helpful as I would hope. But I think parents asking if the child feels safe at school, talking about the masking and making sure their child is compliant and understands the gravity of complying with the mask and the distancing, and then asking detailed questions. How are you doing recess? So that, and I can guarantee you that the schools want to know if the parent is getting a report that sounds like there's not the kind of compliance that you would expect. The schools and the school officials all across our community have spent just a tremendous amount of time devising a way to keep the kids safe, keep the teachers safe, and following those protocols. So I think asking that next level of question, how do you do recess, or how are you doing lunchroom? Are you allowed to take your mask off when you go to the bathroom? And then you'll get to some tips that might be helpful as feedback to the school. Our teachers have a very difficult job, because they're responsible for watching over the compliance of the kids as well as each other's. And it is so tempting, in fact, maybe near impossible, to be compliant 100% of the time without really close attention that we give each other. How many times have you had somebody come too close and you do the, wait, stop, that you're too close, you're closer than 6 feet, or where's your mask? And so I think it is that constant reminders all the time, and being comfortable that it's okay to do that, because it is kind of scary. And the goal here is to contain. We know that the virus is in our community. What we're trying to do is to keep the transmission rate low enough so that it makes sense when we identify a case, somebody who may have contracted it at home, and they're in the school system, and perhaps they have close contact with other people, to be able to do that contact tracing, so that you're not having to say, oh, there's a case, got to close schools. You're saying, Joe in the 3rd grade in Mrs. Smith's class tested positive. Now, he sits next to these 3 kids. We're pretty sure there's been no break in the masking and the social distancing. If that's the case, then little Joe did not give it to anybody. The likelihood is very low. So you're able to do that contact tracing. And I think parents just, if you're choosing to go with the in-school option, we need everybody working together on keeping our kids safe.
Thank you. Mr. Webster, Chairman Strong has talked a bit about how the HEMC folks have been affected by COVID-19. Dr. Hudson mentioned a few minutes ago about fatigue. I wondered if you could talk about the HEMC workforce a little bit, how they're faring, illness rates, but also morale, given what they're being asked to do.
Well, they're put together as a team effort. Like I say, we're seeing the cases. The hard part about it is the ones that you do not know, whether the patient is positive for COVID or whatever the case may be. If it's a patient that has already been diagnosed and you're transporting them from one facility to another, or to a nursing home, or whatever the case may be, those are the ones that you can prepare and make sure you've got all your precautionary measures. With that being said, now we're having to take care, or the paramedics are having to gown up and take all the PPE measures because of the factor that they don't know. So our employees are doing very well through this. The heat has compounded it a little bit with the, putting on the PPE and everything. So they're doing very well, and right now our staffing is doing good. We have had some that have been exposed. They've gone through the quarantine process, and everybody has come out well so far.
Sorry, did you say how many folks are quarantined, or none at this point?
I think, don't hold me to the exact number, I think there was 4 the last time I checked with the HR on Friday. If I think it was 4 employees at that time.
Thank you.
Yes, sir.
Hi, Lee Roop with AL.com. A question for Mayor Battle. You talked about how our metro is doing and the smart community in this around here. What are you hearing from stores, restaurants, places? Are we people being smart and just staying home, or people being smart in the way they're going out? How's our economy doing? Are we just doing it right?
One of the measurable things that we have is sales tax. And when we look at sales tax and where our sales tax is today versus last year, what it was last month versus last year, we're seeing a very steady sales tax in there, maybe even a little bit of an increase over last year. I think Madison is seeing about the same thing. We've kind of compared some numbers to look at. So I think that our retail stores are seeing activity. The home improvement stores are definitely doing well. The big box stores are doing well. Some of the retail that we're having to watch and that we would love to find a way to help is some of them on that second tier, the mom and pops, the locally owned stores. Those are the ones that we need to make sure that we help out. But overall numbers look okay.
Way 31, Grace Campbell. So for Dr. Hudson, it sounds like hospitals will be busy for a while. What's being done to prepare for flu season, and what's the concern about keeping the patients separate? Keeping the patients separate.
Well, that's the easy part, keeping patients separate. All private rooms, nursing staff is masked and face masked, and we're asking patients to mask and reducing the visitors. So that's, in terms of keeping the hospital safe, that is no change from what we've been doing, and we are constantly monitoring the compliance with that and making adjustments and re-educating and things like that. I think that it's busy like it's January, February. There's things that we are not challenged with, and that is space typically, and especially since we flattened things out. We're not challenged with supplies right now, although it's a different challenge than what we might have had, and our purchasing folks have changed how they're acquiring and maybe broadening the number of suppliers so that we don't get caught with one supplier that is giving a majority of a vital piece of equipment. So space and supplies are not the issue. The challenge is the staffing. And again, in the flu season, our teams get very tired because of how sick the patients are, and the fact that that we're running at a higher capacity than what we do most of the rest of the year. Coming into the flu season, I absolutely encourage everybody to get the flu vaccine. And when the COVID vaccine is available, to get that as well. That's the way that we take care of ourselves as a community. It's the way that we keep those vulnerable people out of the hospital. By the more people who are protected against the flu and other viruses like COVID, the better hospitals are able to have that personal touch, that personal care that we have all come to treasure in our healthcare system in this community and in Alabama and in the country. So we just need to keep up the good work on controlling the community transmission here.
And then for Mayor Battle, on the public front, the governor hasn't said much. You've talked about the group of 10 mayors before. What has the governor been telling you, and what kind of support has she provided, especially after the visit from the federal task force?
The governor, the Big Ten gets together and somewhat comes up with a position. Our chairman of the Big Ten, Sandy Simpson, who is Mayor of Mobile, talks to the governor or to the governor's administrative aide, Joe Bonner. We have had many conversations. They have been working with us to make sure that we do the right things. As we talk to them, the biggest thing is that there are some deadlines on a lot of the orders that they put out, and we want to be able to keep ahead of those deadlines. We have been just asking for updates on this as we go through, and they've been very good about giving updates to us. What we've got to realize is that we're not isolated in an island. It's a whole state that has to take action, and the whole state seems to be taking action very well. I think people are taking it serious enough that we're probably seeing some good results out of it. You're seeing the state numbers start to we're flattening that curve with the state also. So it's not as much as everybody would want, but I think it's a good start.
Okay, thank you, and this will conclude our briefing for today.